The other big story we're tracking at this hour, after multiple cases of violence against doctors across the country, the Health Ministry has now come up with a proposal. It has decided to formulate a law to address the issue of violence against doctors in government hospitals. The legislation seeks to punish people who assault on-duty doctors and other healthcare professionals by imprisoning them for up to 10 years and fining them between 2 to 10 lakh rupees. The draft will be finalized and will be made public for feedback.
Many doctors team and the Association of Doctors met Union Minister Harshvardhan in the last year also and this year also. There were several complaints of doctors, resident doctors and other doctors being attacked by the patients by the relatives of the patients in the hospital premises. These doctors went and reported this to the Health Minister and said that they wanted a solution for this, and now the Health Ministry has come with a proposal that it would be introducing the healthcare services personnel and clinical establishment prohibition of violation and damage to property bill 2019. This will be tabled in the winter session this year, but prior to that the ministry has sought suggestions and recommendations from people. They can send their recommendations to the Health Ministry via email or to the Under Secretary. In this it is being said that if a person attacks a doctor and it is found out that there was a clear violation of the rule, under the relevant section of IPC, the person will be prosecuted and jail term may be given to him, and also a fine can be imposed.
Important point, the Health Ministry has now asked for feedback from public on the draft Healthcare Service Personnel and Clinical Establishment Bill, which essentially looks at prohibition of violence and damage to property. Now, the feedback to this bill, to the draft bill, is being sought. Remember, anyone who attacks a doctor at the hospital, as per this proposal, may be jailed for up to 10 years or fined 10 lakh rupees, according to the draft bill proposed by the Health Ministry. Now, let me go across to Dr. Shantanu Sen, IMA National President, joining the broadcast. Good morning, Dr. Sen. Your views on this, a draft bill now being proposed. It actually talks about penalty and punishment to those found guilty. Do you think this was a much-needed proposal? What is your immediate concern about the violence that we are seeing against resident doctors, primarily across hospitals in the country?
All of you. First of all, this assault on doctors and this hooliganism in the healthcare institutions has become a long-standing problem since last many years. And Indian Medical Association has been fighting against the same. And we have been demanding before government that a central act must be brought in to prevent this assault and this type of hooliganism in healthcare delivery system. Because there is no one on earth who doesn't need the help of a doctor. And to keep the society and to keep the nation healthy atmosphere is to be provided to the doctors. And if those doctors are getting assaulted, if they are not healthy, if they are not provided with a healthy atmosphere to treat the other patient, then how the society and how the common people at large can remain healthy and how the nation can remain healthy. So it is a need of the hour, and everyone should take care of that. The doctors should be protected and the doctors should be given a healthy atmosphere to treat other patients. And I must say that media has to play a very important role, because nowadays no one can ignore the role of media in opinion building. So they should take an important role. They should play a pivotal role in creating a social awareness among the common people that doctors should not be beaten up in the hospitals.
Yes, but this is a concern that we've been raising time and again, Dr. Sen. And let's not forget, there was a nationwide protest after what happened in Kolkata. There were doctors across the country who joined in that protest, throwing their weight behind this entire demand that there should be security, adequate security for doctors. Yet we see repeatedly these instances happening. What is the need of the hour? Do you think we need more laws? Do you think we need more security in the hospitals? How do you think this problem can be addressed?
First of all, this has become a pan-India problem, number one. You know, day before yesterday, one 73 years doctor, he was brutally killed by the patient parties. And I am on my way to Assam. I am on my way to Zorat to show our solidarity. The Assam doctors are on strike. So it is not a problem of any particular metropolitan city. It is a problem of the entire nation. And central government must give due importance to this. And central government must bring a proper act and IMA is preparing a draft for the same. And I believe IMA will be mounting pressure on the government, and IMA demands that in the coming session of the Parliament, a central act to prevent violence on doctors is to be brought in the coming session of Parliament. That is one way the solution can be achieved. And the other thing is the mass awareness. You know, public awareness is a very important thing. Public should be made aware that to keep yourself healthy, to keep your family healthy, to keep your society healthy, you should provide a healthy atmosphere to the